Psoriasis is a common skin condition. It's an inflammatory chronic skin condition that can appear at any age, from childhood to old age, but normally it's more commonly presented in younger adults. It shows like red or pink, flat or raised patches. They tend to be symmetrical on both sides of the body. Very commonly affects elbows and knees and also the scalp, but can spread all over the body, can look like little dots. We call it good day psoriasis or small plaque psoriasis. It can affect the whole body surface, as it's called erythrodermic psoriasis, or it can affect the nails, and very importantly, it can affect the joints, produce inflammation and destruction of the joints. So it's very important to have this in mind for patients with psoriasis. The symptoms. Some patients have extensive psoriasis that they won't tell you about any symptoms. And if it doesn't show, they wouldn't be bothered. But if it shows, patients feel embarrassed about people staring at them with very scaly skin. It can be itchy at times. And when patients scratch, they can spread the psoriasis and make it sore. So it can be sore at times, but many patients with psoriasis don't have many symptoms. It's different to eczema when patients are very, very itchy. Psoriasis tends to be less itchy and less problematic, apart from the way it looks, that people get embarrassed and sometimes even depressed because it can show very much when it's on the scalp or on the face. They can feel very embarrassed about having psoriasis. Psoriasis, we think is multifactorial. The triggers for psoriasis are not well identified, but we know the stress can make psoriasis worse, and it can make most of the diseases worse. Genetics, some patients have very clear family background with psoriasis, some patients don't. We think it's an immunological condition. The immune system is overreacting. And there's inflammation, and there are medications that can trigger psoriasis, for example, beta blockers or antimalarial or lithium. They can trigger psoriasis, but many times we just don't know why it appears, and it's a long life disease. The diagnosis most of the times is clinical because the disease is very typical. Very rarely we have to take a small punch biopsy to clarify, but most cases are very easily diagnosed by a GP or by a dermatologist. Mild psoriasis is treated with topical treatments, which means creams and lotions. The treatments that are most used at this time are topical steroids. If they are well used, they can be safe and effective. But if the psoriasis is very extensive, then patients can have light treatment. We use narrowband UVB, which is a similar device to some beds, but it's a medical device where the dose of the light is very well controlled and it tends to be safer. And in cases where the light doesn't help or when it's more severe, we have systemic treatments, immunosuppressants type methotrexate, cyclosporine. They are serious drugs, but they are safe. And if the disease is very severe or have failed to these systemic treatments, then we use biologics, which are very targeted treatments on the immune system, and they are very effective and very safe. So there are plenty of treatments. The disease is not curable, but there are very good treatments to control it. Well, the symptoms they manage with the treatment. As the treatment starts to work, the symptoms will improve. Psoriasis is, as I said, is a long life disease, but some patients go through times when the psoriasis is completely quiescent and they don't have any symptoms or any lesions. In the summer, patients tend to get better. The sun can be very beneficial. But sometimes it just doesn't go. It's very difficult to treat at times for some patients, but it can vary a lot.